It's now my great pleasure to introduce our next keynote speaker, Dr. Emmy Betz. Dr. Betz is an emergency physician who works clinically at the University of Colorado Hospital and conducts research in injury epidemiology and prevention. She's currently a professor of emergency medicine at the University of Colorado School of Medicine, where she's director of the Firearm Injury Prevention Initiative at the Injury and Violence Prevention Center. She's a nationally recognized subject matter expert in firearm injury prevention and suicide prevention, and leads numerous large research projects funded through the National Institutes of Health and the Department of Defense. She co-founded and leads the Colorado Firearm Safety Coalition, and in 2015, she gave a TEDx Mile High talk on firearm suicide. And aside from that impressive resume, I just say that she's a great friend, a generous collaborator, and I'm super thrilled that she is willing to share her time with us. So I will step aside and leave the stage to Dr. Betz.
Great. Thank you so much for having me. Are we okay on slides and audio? Can you see everything? Yes. Okay. I'm going to assume that you can see my slides and you can hear me. Please let me know if you can. But thank you so much for having me today. It's really an incredible honor to be asked to present today. Thank you to Dr. Richardson for that fantastic talk and for the work that you're doing. I put this slide in as a Coloradan. I think a lot about the wilderness and sort of the metaphors and analogies. It's also very appropriate because apparently it's going to snow today in Colorado, even though it's late May. So one of the many crazy things I love about my state. So I, as Dr. Nestis said, I lead the Firearm Injury Prevention Initiative here at the University of Colorado. Our work is really grounded in a belief that no one wants firearm-related injuries or deaths in our homes or in our communities. They include suicide, domestic violence, unintentional shootings, the kind of community violence that Dr. Richardson spoke about so eloquently, police-involved shootings, school shootings, mass shootings, and so forth. And we really believe that we need to address these through a combination of education and research, and certainly policy has its place as well. But grounding all of this is a deep commitment to collaborative work, to engaging affected communities and those with lived experience to find the right solutions for each of these important problems. I do have funding from the NIH and the Department of Defense. I have a VA appointment as well. I have no conflicts of interest for this talk, but I do want to say that everything I'm about to say is really my own views, certainly not those of my employers or any of the funders. But I'd like to start now with really what I consider my real disclosure, which is whenever I think or talk about firearm injury prevention, I believe it's incredibly important to acknowledge our own biases, our own perspectives, our own lived history, so that you all can know where I'm coming from. And also for me, it's a reminder of the potential blind spots I might have. So I work in the ER at the University of Colorado, located in Aurora. I am sick and tired and so sad about the really relentless violence that we see, community violence, particularly young men of color. But I also, on every single day, care for patients with suicide risk. And I have long wondered what more I can be doing for them in that clinical encounter. What can I do besides connecting them to treatment? What are the other things I can do to help them get through a crisis safely? When I'm not in the ER, I'm doing research and doing public speaking and other kinds of things to get the word out, because I believe, as Dr. Richardson said, peer-reviewed publications, especially behind a paywall, are not enough. We need to think about how to get these messages out to the communities who would benefit from hearing them. I'm also, as I mentioned, a native Coloradan, very proud of my Western heritage. I grew up with and still have many friends and family members who spend lots of time in the outdoors, including hunting and other responsible use of firearms. And I hope that when my girls are old enough, if they want to, that they'll go hunting with their grandfather to learn about that part of their tradition, their heritage and their tradition. But like far too many families here in Colorado and nationally, and probably most of you listening today, I've lost loved ones to suicide. Most recently, my cousin Ian, who died by firearm suicide a few years ago. And I'm still angry. I'm still angry that he had a firearm that night. He didn't need one that night. And I'm angry that in his moment of crisis and grief, he was able to reach for that. At the same time that I am doing my best to honor his legacy, I'm, and at times very angry about his access to firearms. I'm also incredibly grateful for the work that I've been doing over the past few years with the firearms community, including through the Colorado Firearm Safety Coalition, which I'll talk about later. Um, so I'm not pro-gun. I'm also not anti-gun. I think I really come from a space of wanting to protect lives and promote health and well-being, and helping our communities get to their best selves. And I think to do that, we really need to be working together. Oh, geez, sorry about that. Okay. Um, I also, before I really jump in, want to spend a moment to just encourage all of us to think about the words that we use. I was very fortunate over the past year or so to work with a group of experts from very different fields, from the hospital-based violence intervention space, from the Second Amendment advocacy space, in thinking about the words that we use and how we sometimes unintentionally cause harm with them when we're trying to talk to each other, and we may shut down a conversation by using terms that others find offensive. So just some food for thought. You may notice the patterns that I use in my own speech. So I tend to say firearm injury and death rather than gun violence, because gun violence is a very loaded term, a sort of politically slanted term for some people. But a couple other key things in the space of suicide to think about. Instead of firearm safety counseling, consider terms like firearm storage counseling, because safety counseling can mean very different things to a firearm owner. It can mean, for example, safe handling. We try not to say commit suicide, because suicide is not a crime. And there's never a successful suicide attempt, because a death is never a success. So instead, we try to say things like die by suicide or completed suicide. So with that introduction, now I want to jump into what I'm hoping to cover in the next 20, 30 minutes or so. First, where we are now. You have to always stop and take stock of where you're starting. Then really thinking about the steps we can take together, and then a few thoughts about the road ahead. And for this talk, I'll be using the approach of really a public health approach in thinking about this. So if we start by saying, where are we now? I want to emphasize some of what you've heard already today, and you'll be hearing later, but the current situation in the United States. I think many of you probably already know this, that over the past decades, firearm death rates have remained relatively constant after a brief peak, and then they came down, and then unfortunately it appears that they're going up again. This is at the same time that we've seen dramatic decreases in death rates from other epidemics like car crashes, or the HIV/AIDS epidemic in the 90s. It's not to say that the solutions will be the same, but the point is that there are more cars on the road than ever, more people driving. People are still having sex, and yet we have reduced the negative impacts of some of those behaviors through a comprehensive public health approach, using education, using policy, using technology and engineering. And that's what I want to talk about today, because that's what we should be doing for firearm suicide and for the other causes of firearm-related injury and death. A public health approach itself can be a loaded term, and so what do I mean by it? I really just mean a cyclical sort of process that involves data, so surveillance, understanding the scope of the problem, then identifying risk and protective factors, including for different subpopulations, developing and evaluating interventions. Not enough to just do it. We need to study it to see what works, and then taking the programs that work and scaling them up, and then repeating that cycle over and over again. So that's a framework I'm going to use today for really focusing in on firearm suicide. So who is it who's dying from firearms in the United States? These next few graphs you'll see are age groups across the x-axis, death rates on the y-axis, and then number of deaths shown also on the y-axis, but in solid colors. So it should come as no surprise that when we think about death rates, the rates for men are much higher for women than in the United States. And so when we look at the total number of deaths also, 86% are among men. It's not to say that those deaths among women are not important, but just we need to think about the populations that we're really trying to focus on. The next question then is, what does it look like from race, ethnicity, sort of broad categories? And this also should come as no surprise, which is that, as Dr. Richardson was just speaking about, there are astronomically and unacceptably high rates of firearm death rates in young Black men, as well as other young men of color. When you look at the number of deaths, you see a different pattern here. So again, for young men of color, it's really a peak in the younger ages. And then there's a very large peak for non-Hispanic white men in the later age years due to suicide. And so we'll talk about that today. Again, in showing this, I'm not trying to say that one of these is more important or less important than the other, but rather just that it's important we consider all of these deaths and the different approaches it will take to prevent them. When you look at women, the pattern is similar, although much smaller. I've shown them on the same graph here, just so you can, again, remember that the bulk of deaths are among men. And so when we look at the total number of deaths in the United States due to firearms, about 62% are among non-Hispanic whites, about a quarter among non-Hispanic Blacks. But again, the rate is much higher in particularly young Black men. And so we can think about all of these things as we identify the problems in particular communities and how we approach them. And so when we think about firearm deaths, another way to break it down is to think about the cause of those deaths. And I don't mean the upstream causes, the important things like adverse childhood experiences and so forth, but really just what was the reason that the trigger was pulled. And what we can see in the United States is that 60% of firearm deaths in this country are due to suicide, about 36% homicide, including domestic violence, youth shootings, community violence. And then a much smaller number are the so-called accidental deaths, especially among children, or mass shootings. Again, not to say that those aren't important. Certainly mass shootings are horrifically tragic and capture all of our attention. But it's also important that we remember the many other causes of deaths. And when we look at suicide death rates in the United States, this is showing over time. You can see the total suicide rate has been gradually increasing over time. And firearms account for about 50% of all suicides. And that's also been roughly constant over time. And so if you care about preventing firearm-related deaths, you have to talk about suicide. And if you care about preventing suicide, you have to talk about firearms because the two are so intrinsically linked that we really can't make a big dent in either without examining that overlap. And that's what I'm going to focus on for the rest of my talk today. So I'd like to move now into really what are some of the things that we can do to prevent these deaths. We talked about surveillance already. And so what are some of the risk and protective factors? This isn't a talk about suicide broadly, so I'm not going to talk about the general issues that can lead someone to being potentially suicidal, because I really want to focus in on the firearm piece, because we know that having a firearm in the home about triples the risk of firearm suicide death. And we know that reducing access to firearms and other lethal means during times of risk reduces the risk of death. And so I'm really going to focus in on the gun today. And there's lots of fantastic work by researchers across this country showing that there is a strong link between firearm access and risk of death by suicide. That's true at the state level, even after adjusting for other things like the prevalence of mental health problems. And importantly, it's not that adults in households with firearms are more depressed or more likely to be suicidal, although Dr. Nestis has led some work recently questioning that. It's not that the gun itself makes someone want to kill themselves. It's that in that moment of crisis, if they can reach for a gun, they are more likely to die. And I do want to pause here to acknowledge that just reducing access to guns is not going to fix the suicide problem in this country. We need better identification. We need to reduce stigma around help seeking, particularly in some communities. We need to make sure people have access to effective care. We need to help build those life skills, connectedness, and long-term solutions. But reducing access to lethal means is a core component of a comprehensive approach to suicide prevention. And there are really three key things you need to know about in terms of why this works and why we focus on it. The first is the timing of a suicide attempt. So suicide attempts may often occur in the larger context of longstanding depression, substance abuse, significant psychosocial stressors, job loss, and so forth. But we know from research that that final decision to attempt suicide often occurs within only minutes to hours, meaning the time from when someone decides to attempt suicide to the time they take action can be very brief. And so it's really about keeping someone safe in that high risk period. And that matters because suicide is not inevitable. Having suicidal thoughts is not a terminal diagnosis. We know that only of people who attempt suicide and survive, only about 10% later die by suicide. So we really just need to get people through that difficult period in their life, and then the vast majority go on to not attempt or die by suicide later. But guns are lethal. They're supposed to be. That's what they're made for. And so if someone attempts suicide with a gun, it is highly likely that they will die. About 85 to 90% of suicide attempts with a gun end in death. Those people don't have a chance to regret what they've done, to call for help, to call 911, to make it to my ER. It's very different than if someone attempts, say, using medications. And so the core message when we think about firearm suicide prevention is about reducing access for those at risk. But I put this picture here to remind us that our first approach should be a voluntary one, very much like a designated driver. Friends don't let friends drive drunk. The first step, if a friend is intoxicated in a bar, the first step is not to call the police to confiscate his driver's license. It's to make sure he gets home safely. And then when he's cognitively, emotionally ready to drive again, that it's okay for him to drive. And that's, I think, really the way that we need to be thinking about firearm suicide prevention. So now I want to talk about what I think some of the fun stuff. So what are the kinds of things that, in particular, I'll talk about some of what my lab is working on, the kinds of interventions that work, hopefully work, and for which populations. For this, I like the framework of the 4 E's, which is education, economic, enactment or enforcement, and engineering or environment. And I'm going to talk briefly about each of these as just an example of the kinds of interventions that we should be thinking about. In the space of education, this is about how, as healthcare providers, we educate patients, particularly those in acute crisis or at risk of suicide, but also about how we move things upstream so that we educate larger communities and we start to ideally have cultural change over time. There's a lot of really exciting work going on around the country from national organizations as well as local or regional programs. Certainly you at Rutgers are doing fantastic work in this space. The American College of Surgeons, the American Medical Association are also doing work around both educating clinicians as well as trying to develop protocols and pathways to support better patient care related to firearm safety. In the space of educating clinicians, I also want to call out the Bullet Points Project in California that's putting out a lot of great content really focused on educating clinicians. And this is one example from a publication from the American College of Surgeons looking broadly at firearm injury prevention, but you can see in the public health interventions, there are a number related to suicide prevention, lethal means safety, secure storage, and so forth. So I'm a practicing ER doctor myself, and I know that even when we mean well, we sometimes are just too busy or too strapped for resources to spend the time with patients that we would like to. And so a few years ago, my team and I, we were fortunate to receive funding from the National Institutes of Health to dig into this a bit. And we developed a decision aid that's intended for use with patients with suicide risk. It's not intended to replace those conversations with a clinician, but it's something that a patient or with or without a family member could work through on their own to make a plan for what they want to do with firearms. So it's really intended to walk through that conversation about educating and engaging someone when you are at risk for suicide, why it's important to reduce access to firearms, which is all of the things I just told you. And then importantly, to walk them through a series of decisions so that they can pick the solution that's right for them. So to some extent, we're forcing a choice in that we're pushing them towards doing something to reduce access, but we're giving them a menu of choices of ways to do that. Storage out of the home, storage in the home, transferring to another person, disabling the firearms, and so forth. because we know from decision science that if someone makes a choice that feels right to them and is in line with their values, they're then more likely to take action. This tool is available in English and Spanish for free. It's completely anonymous. We're not making money off of it. We would love for you to use it and let us know what you think. It was highly acceptable in a pilot trial, and it's currently being tested in 2 large studies in the Kaiser healthcare system. And there's also a version for parents of adolescents. But these are, I think, an example of the kinds of creative education approaches I think that we need to be getting out to people in ways that are respectful and engaging. I also want to talk briefly about gun shop projects. A huge shout out to the New Hampshire Firearm Safety Coalition that started this original concept. When they started the first coalition between a firearm retailer and some public health professionals. And you can see on the map, there are now examples of gun shop projects in states across the country. In Colorado, we don't run our gun shop project, but we support them through the coalition. We meet regularly and brainstorm and help get resources out. The idea behind these projects is really to get education and materials into firearm retailers and ranges, into courses, into the places where firearm owners go so that they start to hear these messages. One of my favorite speaking events ever was at a ladies' night at Centennial Gun Club. There were 100 women there who'd come to shoot. They were very knowledgeable about guns. But many of them had never heard the basics about suicide prevention, that it's okay to ask if someone is having trouble, how to get help, and so forth. Some other interesting examples, National Shooting Sports Foundation and the American Foundation for Suicide Prevention have developed materials that they're distributing at a national level to independent firearm retailers. You can see in the top right. Walk the Talk America in the middle of the screen is a group that's really trying to bridge mental health and the firearms community, including destigmatizing mental health care for those in the firearms community to encourage people to seek help when they need it. And then the bottom right is an example from the Navy. So the Department of Defense and the VA are really leaning into this space as well. And last but not least, there's a wonderful program in Washington called Safer Homes Suicide Aware that's doing a lot of education for the firearms community, as well as for pharmacists, actually, about reducing access to medications as a suicide prevention strategy. The core message in, I think, all of these programs is, I think, really embodied by this short PSA that I want to share. This was created by the Utah Suicide Prevention Coalition, and it's one of my favorites. Oh, hang on a second. Oh, geez. Let's see. It seems like we have no audio. Just a moment. Try this one more time. Okay. Well, I think my audio is not working this morning, so I'll move on. But basically what he says is, a few years ago, he was having a tough time, and his buddies came over and said, "We're worried about you. We'd feel better if you let us hold on to your guns."
Emmy, the audio was working.
Oh, it was working.
Yeah,
Oh,
you're
geez,
good.
I just couldn't hear it. Okay, we're gonna try it again. Thanks, Mike. Okay.
Last year, I was at my lowest, going through some pretty serious depression. A couple of friends of mine stopped by the house and said they were worried about me. Said they'd feel a lot better if they could hold on to my firearms until things turned around. I think they saved my life.
If your loved ones are struggling, talk to them about temporarily storing their guns away from their home, because things do get better.
Okay, wonderful. So I couldn't hear it, but I've heard it before. But part of my point here is actually that if you want to talk to middle-aged or older white men who own guns, I am not the person probably who is best at doing that. But having messengers that feel credible, that feel like they're from within the community, can be particularly helpful. And so when we think about these kinds of projects, a lot of it is about focusing on temporary and voluntary changes with trusted individuals and making sure that the messengers who are delivering the message also feel trusted. Lately, our group has been thinking a lot about suicide prevention in older adults. And as part of that project and in talking with older firearm owners, we heard a lot about the need for resources related to planning for reducing firearm access in later life. And this is another tool that we've just recently developed and released. It's also free. We'd love for folks to use it and let us know what you think. It's not directly focused on suicide prevention, but it is aimed at encouraging adults to think about maybe getting rid of guns they don't use anymore, passing them on, donating them to museums and so forth, which may have a secondary effect in suicide prevention if that older adult then doesn't have access when they potentially develop thoughts of suicide. So now I want to move on from education, because education alone is not going to fix this issue. Economic incentives can sometimes be very helpful in helping change behavior. And so here I want to talk specifically about locking devices and whether giving out locking devices helps. Most programs, and there are lots of people around the country examining this and trying this out, most places give out cable locks, which is shown here. They're cheap. They're $1 to $2 if you buy them in bulk. They usually have a key. But one downside is that the firearm has to be unloaded for the person to use this lock. And I'm going to come back to why that can be a problem. Huge shout out to Dr. Nestis and team for the work that they did in Project Safeguard in Mississippi, which was a project that involved lethal means counseling and or distribution of cable locks to National Guard members who were firearm owners. And really importantly, this study was people without active suicide risk. So this was moving upstream in the community, trying to get out general messages about secure storage and how that might actually help prevent suicide. And they found indeed that those who received counseling or those who received cable locks were more likely to say that they had locked up firearms at home. I think one question that Dr. Nestis and I are now digging into, though, is what devices should we be giving out? Because there are some studies that have shown that that firearm owners would rather use other types of devices depending on their reason for ownership. So someone who goes hunting once a year might have a large safe in the basement for their rifle or shotgun. Someone who owns a firearm for personal protection may want to have it on their bedside table. And if they're going to lock it up, they may want to use a quick access lockbox like the one shown in the middle. You may agree or disagree with the reason for ownership or the reason that they have it in their house in the first place. But that doesn't really matter, because as health professionals, if we want to encourage people to have more secure behaviors at home, then handing them a cable lock that they're not going to use is not going to help. And so I think, really need to be focusing on what is it that people are likely to use at home, and then thinking about what kind of economic incentives might help get us there. Coupons, providing free devices, and so forth. Also so that programs can stop spending money on something if it's not effective. So if giving out cable locks doesn't help, why don't we save our money and spend it on things that do? I want to talk briefly now about enactment and enforcement. I personally don't do a lot of work in the policy space. There are many national experts in this field. I do want to just mention one aspect, though, of extreme risk protection orders. These are laws that are often cited as a suicide prevention tool. They've been enacted in many states across the country, and it's estimated that they can prevent one suicide per 10 to 20 firearms removed, and you can decide if that feels appropriate or not. But here in Colorado in 2020, in 2019, when our law was passed and then went into effect in 2020, it was a really interesting and controversial time with a lot of counties that were very opposed to the law. Some declared themselves Second Amendment sanctuary counties, where they said that they wouldn't enforce the law. It was a really heated debate. And so our group has been very interested in how the laws have actually been used once they were put into place. So we reviewed the petitions that were filed in 2020. Most of those did go on to a temporary or 2-week extreme risk order. And importantly, it was far more likely that a petition was granted if it was filed by law enforcement. I think a lot of that has to do with the level of evidence that law enforcement would include on the form compared to family. And I think that speaks to the need to have better support for family and understanding what they need to include on a form if they're really, truly worried about someone. And then about 80% of the temporary 2-week orders went on to a full extreme risk order. And you can see it was a mix for suicide risk, homicide risk, or mass shooting risk, or a combination of both. Importantly, in that year of petitions, there were only 3 we saw that were blatant misuse of the policy, where someone really was fabricating evidence or didn't have a relationship. And importantly, all of those were denied. I think we need more work looking at how these laws are used, how they're potentially misused, if at all, and what happens afterwards. How are firearms returned? Are they not returned? Sort of the process after the space. Because I do think there are certainly cases where an extreme risk order is warranted, but it's not enough to just put the law in place. We need to be understanding whether it's actually working. And then I want to end with one of my favorite spaces, which is out-of-home storage. And as we think about engineering and the environment, and how do we make products and the environment around us safer? So in some spaces, this could mean things like smart guns and so forth. But I really want to talk about how do we change the environment to potentially prevent suicide. One of the recommendations for reducing access to firearms during times at risk is to move firearms out of the home. That can be with trusted individuals, depending on your state laws, or people often cite gun shops or ranges or law enforcement agencies as a place to temporarily store weapons. So back in, I think 2018, our team created the first statewide map showing locations that were willing to consider temporary voluntary firearm storage. So this is a map of Colorado. The red locations are firearm retailers and ranges, and the blue are law enforcement agencies. Since that time, it's been really exciting to see how a number of states, including New Jersey, now have maps as well. And we were very grateful to receive funding from the NIH to work with researchers in the University of Washington to try to understand how these maps might be used or not, and the general concept of voluntary storage. And we've now done a number of interviews, surveys with firearm retailers, ranges, law enforcement agencies, firearm owners, family members of firearm owners, to try to understand how temporary storage might be used. And I think the take home for me thus far has been that the potential storage locations like ranges and retailers and law enforcement agencies, they want to help prevent suicide. They want to be good partners. They want to serve their communities. But they have some concerns. Some are easy to address around space or sort of cost. But the big one that I think that needs to get fixed is the liability question. So if you've been temporarily storing someone's firearm and they come to get it back and they seem fine and you give them the gun back and then they use it to hurt themselves or someone else, are you as a storage supplier now liable for that action? And there's not a good answer yet. And I think, I hope we can find some solutions to that in terms of providing some protection or assurance or something so that we can make out-of-home storage more feasible for people across the country. The last step, certainly any intervention that works ideally would be scaled up. And it's wonderful to see researchers with expertise in dissemination and implementation really digging in to firearm-related questions. There's a large trial going on right now looking at interventions in primary care and pediatrics. There's some CDC-funded work examining the gun shop projects and whether they're working or not and how they could be spread. I do think we need more around extreme risk orders, best practices, and so forth. And then again, a shout out to the VA and the Department of Defense, who are really looking at this on a bigger scale and trying to understand how we can support means safety efforts. So in my last just few moments, I want to share a couple, I guess, sort of parting thoughts about where I would love to see things go in the coming years. I'm thrilled at the conversations we are now having in the suicide prevention field around firearms. They're conversations that wouldn't have happened even a couple of years ago. And I'm very grateful to see suicide included in your agenda today, because I think sometimes we forget that suicide is also violence, albeit of a different type. I think for anything we do, we've got to make it easy for people. If we are expecting behavior change, we need to make it easy for them to do the right thing. And we need to remove obstacles from the path. So if that's around secure storage of firearms, how do we make it easier for people to access locking devices, to get free locking devices, to move firearms out of the home and so forth? I think it's not, especially for people who are in the midst of a crisis, it's not fair to expect them to go through 17 extra steps because then many people just won't do it. I think we also really need to make it universal. And again, thanks to Dr. Anestis and his team for the work they did in Project Safeguard, taking things upstream. We need to start having these conversations before someone develops suicide risk. Absolutely, once they have it as well. But many people will never seek care if they're having suicidal thoughts. Many people won't even realize that they are suicidal because they may experience depression as anger instead, or sort of not fit the mold or not see themselves as depressed, but be at very high risk. So I really would love to see us make these conversations universal, upstream part of the culture, in the same way that friends don't let friends drive drunk and designated driver messaging has just sunk into the culture due to repeated PSAs and ads and all of it, the way that it's been integrated into the culture. I think that's what we need to do around firearm suicide prevention as well, including for parents to recognize that teens are at risk of suicide. And then in fact, far more teenagers die and teenagers and young adolescents die of suicide every year than in school shootings. And so how do we help parents understand that that unfortunately is a real risk? But I also firmly believe we need to do this together. If we're hoping to educate firearm owners and the firearms community, of course, we can't do that without working with them. We need to develop the messages and the education approaches, and ideally have homegrown projects from within, in the same way that Dr. Richardson's talk was focused on working with affected communities, with communities affected by community violence and young men who've been scarred by violence. In the suicide space, it's the same, albeit with different communities. We also need to recognize that certain communities are having increases in suicide, where previously they had very low rates, including young individuals of color. And so the point here is that we really need to be engaged in respectful listening and dialogue to figure out what's going to work and what's going to work for different communities. That includes working with the firearms community, working with firearm owners, working with people from the suicide prevention community and those with lived experience, to recognize, that this crazy roller coaster of life, we're all going to have rough spots. And if COVID taught us anything, it's that things get hard and it's okay to talk about our mental health. Because at the end of the day, really none of us want firearm related injuries or deaths in our homes or communities. And I have a lot of hope. I mean, both that I think what we need to give people in times of crisis is we need to help them find hope and find that light in the dark. But I'm also feeling very hopeful about the direction that the field is heading. And I think by working together, we can all get to a better place, just to the next day together, and hopefully reduce violence in our communities and reduce injuries and deaths. So thank you again for having me. I'm happy to take any questions, and I'm happy for folks to contact me later as well. Thank you so much.
All right, thank you, Emmy. That was a great presentation. I know we have a couple of questions from the audience, and so we'll get through, guys, as many as we can. First one that pops up is, what is the success rate of non-firearm suicide attempts?
Yeah, thank you for the question. I am going to briefly reframe it because we don't want to say success rates for deaths because it's not a success if someone dies. It really depends. For hanging, case fatality rates can be pretty high, I think in the 60s to 80%. And then medications, it greatly depends on the type of medication, but it can be, I think overall it's down in the 2 to 5%. It's very, very low.
Thank you. And then our next one is, can you clarify about locking devices again? Our group gives free gun locks to gun-owning families and would like to make sure we are giving the best researched option.
Yeah, thank you for the question. I think this is still an area of active debate. So if you're giving out cable locks, don't feel bad about it and don't go throw them all out. I think, as Dr. Anestis showed in his study, cable locks alone may help. There's been some work from the University of Washington and the Safer Homes Project where they gave options. They had cable locks as well as lock boxes and coupons, and different people took different items. So I think it depends on your budget. I do think if you can, including the option for quick access lock boxes is a good idea, because some people are just not going to want to use cable locks. I've heard people refer to them as an expensive paperweight. It might be a short-term measure, and it might be a cue, some swag to remind people to do something when they get home. But I would love to see more work, particularly in this space.
Great. And I think we have one more coming up. Yeah. How would you suggest those doing research and living in states without firearm storage maps work to make them available?
Yeah, for sure. So feel free to contact me. We can talk about it in more detail. I think there are sort of two pieces to it. So one is just whether storage is actually an option. The second is whether you have a map, and the two things are not necessarily connected. So you can work with local retailers, for example, to see if they'd be willing to provide storage. So if you work at a hospital, you could find the gun shops around you and then be able to refer people to it, even if you don't have a map. For places that have built maps, it often has been sort of a volunteer effort or come from an academic center that has, say, students who want to call all of the places in the state. But please feel free to reach out. I have lots more ideas about how to do it or not.
Okay. All right. Well, Emmy, again, thank you for joining us today.